experiencing an increase in COVID-19 positive cases, and the Ministry of Health has urged all regional directorates to react to the COVID-19 testing facilities. Now, to give us more details on the matter, I'm joined via Zoom by the Executive Director in the Ministry of Health and Social Services, Ben Nangombe. A very good evening, Mr. Nangombe. Thank you so much for joining us.
Thank you very much. Good evening.
All right. Now, Mr. Nangombe, let's begin with some of the latest statistics in the country. Active cases, hospitalization, and of course, where we stand with the vaccine uptake.
Yeah, no, thank you very much, NBC. As we are following the COVID-19 epidemiology around the world and here in the country, we are seeing that in some parts of the world there is an upsurge. Here in Namibia, the situation continues to be stable. The data that I have at my disposal at the moment is data for the week from the 12th to the 18th of December 2022. The intervening weeks, the information is being prepared. So for the week of the 12th to the 18th of December 2022, we have recorded positive confirmed cases 61 from 508 samples that were tested. This represents a 12% positivity ratio. Of these cases, 50 are new and 11 are reinfections. And the gender distribution is 32 males, of whom 24 are new cases, and 29 females, of whom 26 are new cases. The ages are ranging from 6 months to 106 years. In terms of regional distribution, we are looking at 24 cases. These are new cases from the Commerce region and 5 reinfections, bringing the total to 29. For Erongo region, we are looking at 12 cases, new infections, and 4 reinfections, bringing the total to 16. Oshana, 9 new cases. Ohangwena, 2 new cases. Ochodonjupa, Oshikoto, and Omsati had 1 new case each for that period. So in total, we are talking about cases being reported from 7 regions around the country, and 5 of them are health workers, 5 students, and 1 learner. Of these cases, the 50 that we are reporting for the period, 1 case has received 1 dose of COVID-19 vaccine, 16 are fully vaccinated, and 6 have a booster dose. So those are the statistics as far as the new cases and reinfections are concerned. And we want to inform, of course, that for the period under review, no deaths were reported.
Now, Mr. Nangombe, last week, the ministry issued a report that cases in the Erongo and Commerce regions were on an increase again. Now, is the concern only in these 2 regions, especially noting that many people will be traveling during this period?
When we do the surveillance activities, we do surveillance across the country. That's why when we gave a directive to the regions to reactivate testing activities, this has to apply across the country. But of course, what happens generally is that when you have an increase in cases in a particular area, you hone in that particular area. And the reason for doing so is to make sure that you pick up possible clusters that may be forming, and to be able to respond to those and address them as they occur. So wherever the cases are increasing, that is where we must pay specific attention to make sure that the cases that are being reported are being recorded correctly, are being followed up correctly. You do contact tracing. You monitor the situation of hospitalizations, for example, if there are any, etc., etc.
All right. Now, Mr. Nangombe, as you may know, as you may have heard, there is a new variant ravaging in the United States. Should we also be worried?
You see, the world has become a village. People are traveling from one corner of the world to the other. That is why we continue to urge members of the public to be cautious, because you will never know when a particular person is traveling from one area coming to Namibia, for example. And as we have the situation currently, the COVID-19 regulations were basically relaxed. We are not requiring at this point in time, for example, for travelers to have specific permits or to give proof of vaccination or anything like that. So, but we are monitoring the situation. At this point in time, we believe that the situation in Namibia remains stable, but as we are also a recipient of travelers from different parts of the world, that is why we have increased testing. That is why we have ramped up our surveillance activities to be able to respond to the situation and the epidemiological trajectory of the disease as it evolves.
All right. Mr. Nangombe, thank you so much for joining us this evening. Unfortunately, that's all the time we had. And thank you for the update and Happy New Year.
Thank you very much. Happy New Year to you.
All right. That was Ben Nangombe, who is the Executive Director in the Ministry of Health and Social Services, just giving us an update on the latest COVID-19 statistics.